Hi, I'm Michele, and I'm here with Sandeep and Emily from Tower Physicians Solutions, and we're going to audiocast this conversation today. We're going to be talking about medical practice solutions, and more specifically, MACRA, as it relates to nephrology private practices. Sandeep is a meaningful use coordinator, one of the many experts and specialists on the subject of MACRA. Sandeep works full-time on guiding our Tower clients towards a solution that best fits their practice needs. She can actually relieve some of the pressure of learning about new changes affecting private medical practices. We're going to be talking about medical practice solutions and more specifically MACRA today, as it relates to nephrology private practices. So to put it in simple terms, nephrology is the branch of medical science that deals with diseases of the kidneys. We're talking about the back office side of patient practice. So there are two parts here. There's the patient care, and then there's the business side, which we'll be discussing here today. Sandeep, why do nephrologists in private practice need to know about MACRA?
Okay, so starting in 2019, Centers for Medicaid and Medicare Medicaid Services will change how they pay physicians in a very profound way. The details are complicated and confusing. We are going to focus more on 5 immediate concerns today. The first concern is that the rule only applies to private practices and Medicare, not hospitals. Number 2, 2017 performance data is going to determine payments in 2019. Number 3, MACRA has 2 paths. One of them is MIPS, Merit-Based Incentive Payment System, and APM, which is the Alternative Payment Model. Number 4, most physicians will be starting with MIPS. Performance data will determine what type of penalty or incentive they are going to receive. And number 5, MIPS will adjust physician pay based on their total composite performance score, which will be determined from 4 categories. Number 1 being quality care. Number 2, cost of care or resource use. Number 3, clinical practice improvement activities. And number 4 is the newly branded Advancing Care Information Program, which is the new name for a modified meaningful use program.
Wow, these are some really big changes that are going to be coming up. And so how could a private practice really prepare for all these changes and for MACRA?
For starters, practices should, number 1, outline a strategy for tackling MACRA by quarter 4 of 2016, focusing on measures that their practices perform well on, and take a look at their quality measures and identify their high-performing areas. They should also educate themselves and their partners to encourage discussion about the new regulation. Number 3, the practice reported on PQRS last year. They should review the CMS Quality Resource and Use Report, also known as the QRUR report, to compare their quality performance with other providers in their specialty. And number 4, practices should ensure EMR technology is certified and determine which quality measures the technology can report on, since most EMRs cannot report on all 300 measures.
Okay, wow. So I would imagine that there's going to be some challenges that a small nephrology practice is going to face in preparation for MACRA. So why don't you identify a few of those for us?
So a couple of things here. Generally, larger organizations are considered better equipped to manage and coordinate care, improve quality, and lower costs than are the small groups of doctors. This means incentives can be higher for those in the larger groups versus small practices. The way MACRA is set up currently, small practices will be at a higher risk of incurring penalties.
Sandeep and Emily from Tower Physicians Solutions, and you're listening to an audiocast, and we're discussing MACRA, and we're talking about the business side of patient care and all the changes that are going to be happening very soon beginning in 2017. Okay, so Emily, why don't you kind of enlighten everybody as to why Tower Physicians Solutions is really your overall best solution for private practice to be most prepared to handle MACRA and all the different changes that are going to be coming their way.
I'm happy to. Tower can provide you with the resources that you need to determine the best quality measures for your practice. Those of us at Tower will determine which measures you are performing well in and help you create a strategy for how to meet the other measures. The Tower experts will help you become fully prepared for MACRA implementation by developing the strategy and helping you every step of the way.
It's clear to see that this could become very costly for these private practices really fast, and that if they're not prepared, then they can be in, a whole lot of hurt really fast. So tell us, what could they do right now to get started and to start to educate themselves a little bit?
Sure. The most important thing is to get educated now. Quite simply, you can call Tower Physicians Solutions. We will get you on the right path in a timely manner so that you can be prepared when 2017 rolls around.
And it's probably going to roll around a lot faster than anybody could imagine. So, Emily, how could a private practice, a doctor's office, get in touch with Tower Physicians Solutions?
Oh, that's easy. Just give us a call or send us an email. The phone number for Tower is 630-243-5731. 243-5731, area code 630. And then our email address is info at towerps.com. Info at towerps. And just send us an email. We'll get right back to you, and we can start working out a plan.
Great. A lot of information here. I hope that, we helped shed some light on the whole MACRA situation that's going to be coming up. And Tower Physicians Solutions is there to help you through this whole transition. So give them a call. Sandeep, Emily, thank you so much for the information shared with us today.
Thank you.
You're welcome.